My name is Dr. Nicola Mitchell-Jones. I'm a clinical research fellow here at Chelsea and Westminster Hospital. The most severe form of pregnancy-related sickness is termed hyperemesis gravidarum. This is where women suffer intractable nausea and persistent vomiting. It causes a severe amount of physical illness for women and also affects them mentally, emotionally and socially in their lives.
It's affected me quite badly, if I'm honest. It made my pregnancy quite unenjoyable, quite stressful and quite emotional. I'd suffered previous miscarriages, and so on top of the fear of another miscarriage, I was also feeling completely rotten. And I remember at the time thinking that it was a worse feeling than any pain I'd ever felt. It was really crippling. So I found it quite isolating and upsetting at the time. When I first started to feel sick, I realised it had got to a point which I felt was beyond a normal level of sickness. It was really quite crippling. And I sought the advice of my GP, who I really respect, but he took quite an old school approach, said that the medication wasn't appropriate and I should just push on through and almost wear it as a badge of honour that it was, you know, my pregnancy taking hold. And I knew I had to seek some further help. So the early pregnancy assessment unit at the hospital were massively helpful. I was given one-to-one care with someone who took it very seriously. I was given a great medication to help with the sickness, which took hold quite quickly. And I was also put on a drip to deal with my dehydration. I think if I hadn't had that care, I honestly don't know how I would have continued through the pregnancy. I was really in such a state.
At the moment, we're really focusing on just the physical management of the condition, so treating women for dehydration when they present to hospital. We give them a fluid drip to rehydrate them, anti-sickness medications and vitamin therapy. We don't have a cure for the condition, so treatment is largely supportive. What we need to do is provide a package of care which addresses the other consequences of the condition, such as the social, emotional and psychological consequences we know occur as a result of the condition. Our research has been focused on improving the care that we offer for women with hyperemesis gravidarum, and what we would like to see happen in the future is that units develop specialist services for women with the condition, which encompass the wider implications, in particularly the social and emotional, psychological sequelae which can occur as a result of the condition.
Obviously now I'm thrilled to have my daughter, and after quite a slog of trying to get pregnant and stay pregnant, it's amazing to have her here. I don't look fondly on pregnancy as a result of the HG, it's fair to say, but of course now that she's here, it's in the past and we're just focusing on her.